Before starting our case, we need to look for some anatomy basics of the wrist joint. This is the scapholunate ligament and the leono-triquetral ligament. The scapholunate ligament is triangular in shape, and the leono-triquetral ligament is horseshoe shaped, and they are intact here. This image shows the scapholunate ligament tear. The scapholunate ligament tear, as you can see here. Scapholunate ligament tear is seen only on MRI, but can be detected or can be suspected on X-ray of the wrist joint by widening of the scapholunate interval. This is the scaphoid, and this is the lunate, and this is the scaphoid. The scapholunate interval is widened, denoting traumatic avulsion of the scapholunate ligament, which is seen here. Avulsion of the scapholunate ligament on the stair image. On scapholunate ligament avulsion, the lunate attachment of the ligament is very strong compared to the scaphoid attachment of the ligament. So you will always, or usually, you will see that the avulsion is at the scaphoid attachment of the ligament because it's weaker than the lunate attachment of the ligament. This is the triangular fibrocartilage complex is seen on the axial MRI as triangular structure. Is seen on the sagittal MRI as discoid shaped structure. On the coronal MRI, seen as biconcave disc, a biconcave disc with radial attachment and ulnar attachment. The triangular fibrocartilage complex on coronal MRI arises from the articular cartilage of the medial aspect of the radius and inserts into the ulnar styloid process by two facets, as you can see here. So this is not rupture because the ligament inserts by two facets into the ulnar styloid process, and this is the normal shape of the ligament. So let's start our case. So this is the X-ray of the wrist of the wrist joint of the left hand of a patient with left wrist pain for 3 months. The distal articular surface of the ulna. The distal articular surface of the ulna extends past the distal articular surface of the radius. Interpretation: positive ulnar variance. So on X-ray, if you see the ulna, the distal articular surface of the ulna is not at the same level of the distal articular surface of the radius, this means that the triangular fibrocartilage complex is not working. Why? Because the main importance or the main function of the triangular fibrocartilage complex is to maintain the articular surface of the ulna with the articular surface of the radius. So if this disrupted, so you need to check for the triangular fibrocartilage complex. This is called positive ulnar variance. So let's check for the triangular fibrocartilage complex. Okay, the best sequence to check for any disease of the wrist joint is this sequence. You will see here proton density, fat suppressed. This is coronal proton density fat suppressed image of the left wrist joint showing. We'll start by this one. Sorry. So we need to check for the triangular fibrocartilage. So let's check for its radial attachment, as mentioned before. Intact radial attachment of triangular fibrocartilage complex. This means what? This is not of traumatic cause. So if the reason of the wrist pain is a traumatic cause, or you expect that triangular fibrocartilage complex is injured due to traumatic cause, you will find here rupture of the radial attachment of the triangular fibrocartilage complex. So here, no traumatic cause. What about the ulnar attachment of the triangular fibrocartilage complex? It is disrupted. There is a high proton density signal in the triangular fibrocartilage. Which part? There is a high proton density signal at The ulnar styloid process attachment of the triangular fibrocartilage complex, denoting tear of the triangular fibrocartilage complex, and this tear of degenerative cause. Interpretation: triangular fibrocartilage perforation of degenerative cause. There is also high proton density bone marrow signal and subchondral cystic changes at the articular surface of the lunate and the triquetrum bones with the triangular fibrocartilage complex. So, the interpretation: positive ulnar variance, degenerative tear of the triangular fibrocartilage complex, degenerative changes, subchondral degenerative changes, and bone marrow edema of the articular surface of the carpal bones. Diagnosis: ulnar impaction syndrome. Ulnar impaction syndrome. Differential diagnosis: traumatic cause of triangular fibrocartilage complex tear. Traumatic cause of triangular fibrocartilage complex tear. However, there is no history of trauma here. So the management here, I would contact the referring physician to convey the findings and to recommend orthopedic referral.